Well, I'm very excited to have the opportunity today to talk with Charlotte Sibley, who's a well-respected figure in the market research and insights field, and has also been a longtime board member of MRII, it's Market Research Institute International, as well as former president. And so I'm really excited just to pick her brain about how she got into the field and what advice she has for folks early in our career. Charlotte, thanks for joining me today.
Thank you, Steve. It's an honor to be here. I majored in French and German and intended to go on for a doctorate in Romance languages at Yale, and I was going to be a professor of French literature somewhere. Ended up one summer on Wall Street and went to business school instead. And I was recruited by Pfizer into market research. And this was before anybody really knew what Pfizer was. In fact, one of my colleagues called it Pfizer and thought it was an agricultural company. Pharma to him was agricultural. And somehow the science, the drugs, the science part of it really interested me. If I hadn't had monocular vision, maybe I would have gone to medical school, but I think that was the draw. And everyone said, oh, you will want to go into marketing, but I didn't. I never really wanted to. I loved market research, and market research in the pharma industry was rather primitive back then, mostly focus groups and a lot of IMS data. And slowly but surely, as we got into quantitative, I loved the analytics. I loved the data. I always loved math. And that to me was the place to be to make fact-based decisions.
It's interesting how people end up in our field, and so few of them kind of studied it in college and went in with an intention of this is what they're going to do, and they kind of find their path, almost by accident and serendipity, and discovering, like you said, kind of a love for not just data, but consumer insights and really what makes people tick.
Right, right. And I think the psychology courses, I was at the University of Chicago at the business school and did have one market research course with Bob Blackberg. And that intrigued me. But you're right, the psychology part of it, plus the economics part. And Pfizer at that point, I was the first MBA they hired into market research. And just decided that I wanted to continue my career there. But part of my drive in the industry, I spent 2 years at Lipton, and that was what I call hardcore heavy duty CPG research. And I learned a lot. I just wasn't invested in the products. I knew I was not the typical consumer. I lived in New York City in an apartment. I went to the opera, but the training was terrific. And I came back to the healthcare industry determined to have us be more rigorous as we were in the consumer products, and started to do some really exciting things. Did the first perceptual mapping study in the pharmaceutical industry when I was at Squibb as we were launching a new cardiovascular drug. And from then on, trying to make sure that we incorporated strategic forecasting, decision science, competitive intelligence to have an umbrella of insights and analytics in one department and not spread out over many, many departments. That to me was the exciting part of my career, to build all of those functions and have them integrated. We used to say one source of the truth. And for the
Uh,
most part, that's what we could provide.
that's a great phrase, one source of the truth. And it's also interesting how many people I've talked to in market research who did a couple of years in kind of a hardcore CPG, whether it's P&G or Unilever. It's almost kind of like getting an MBA and really learning how brands work. That's really interesting.
Mhm.
Yeah, and the other interesting thing I find about pharmaceutical research is that it tends to be highly specialized because there's so many, both consumer issues as well as like legal issues, like adverse event reporting. It's very highly specialized. So, sometimes it's, I guess, once you get into a pharma track, that's where people tend to stay. Is that your experience?
Yes, indeed. And I think there's a bias in the pharma industry if people haven't had pharmaceutical experience not to hire them. And one of my concerns is for years, the industry has said, we're different, we're different. Well, yes, we are different to some degree. We have a learned intermediary. There are adverse events. There are a lot of things we are constrained about, but from medical and legal point of view. But at the end of the day, we have a customer. We call them patients. Or we called them providers, but they're doctors and nurses and pharmacists. They're consumers now, particularly with direct to consumer and a lot more decision making on the part of the consumer about healthcare, and hospitals and payer systems. And I think once managed care started to make a serious impact in the industry, and once we started direct to consumer, then we started to think about more than just the doc. And start to think about the entire environment. And that's continued. I think we still have to go further. I think there is still the sense that we're entirely different. The overlap is becoming less and less, more and more, I think, with consumer. And the more that we can learn from them, and they can learn from us too.
It all comes down to people and how they process information and how they make decisions and their ambitions and their anxieties. And yeah, very interesting. So what advice would you have for folks kind of early in their market research insights career to help them grow?
In general, I give advice in terms of overall career management: network, network, network. Inside your company, outside your company, not just in your function. Deirdre Connolly, who was president of GSK, said at one point, be a student of your function, your company, your industry, and I would add the world. And the thing that market researchers, I think, bring to the table is that why. And so why is that? Why is that? I've often thought that whether it's marketing or R&D, there's sometimes fire, ready, aim. And market research has to be ready, aim, fire, and why. What's the impact? What are the downsides? What are the implications? How do our customers feel about it? I think those questions and framing the issue appropriately, the sooner that one learns how to frame the issue, the consulting companies are terrific at this. Frame it and make sure, because typically the question that is asked by new product managers, many of whom have just come out of the sales force, it's a very specific question. And the key is, what's the real issue here? What is the decision we need to be making? What is the action we plan to take? And I always ask a few questions of that. That's the first one. The second one is, how did this come about? Is this something we saw in the field? Is it from previous research? Is it an I wonder from the CEO? I had a few of those, and we were about to launch a $600,000 perceptual mapping study for an I wonder. Thank heavens I thought to ask the CEO, what did you really mean by that? It was something different. And then what do we already know? Have we researched this before? And very frequently we forget what we did before, and the previous knowledge is with our consultants, our strategic advertising agencies. And the final question that I always ask is, what are we going to do differently if the answer is A versus B? If we're not going to do anything differently, then just make the decision, just go ahead. Or if the cost of the research is going to exceed the value of the decision. So I think those things, keeping in mind those things for a beginning researcher. And the other mantra that I use is thanks to Lieberman research, which I absolutely love, which is the what. So what does it mean? Now what? I'm saying what? So it's been a while since I've done this. What does it mean? So what? Why is it important? And now what? What do we do about it? So thank you, Lieberman. It's a great way to start to frame a lot of stuff that we see and put it into a really meaningful insights package for our colleagues.
That is a great way to phrase it. The so what and the now what. Because a lot of times I counsel students, I borrow the line from Stephen Covey: begin with the end in mind. Think about the kind of advice that you might offer, the kinds of decisions that might be made, and then work backwards to figure out, okay, here are then the kinds of questions that I would have to ask consumers.
Exactly, precisely. And I learned that at Lipton. When I was trying to make up a grid, my boss said, write the final report. And I thought that was really weird, until I started to write the final report and realized that a couple of those key conclusions, I wasn't asking those questions. So yes, that's great advice.
That's great. That's great. I'm also reminded of something that Jeffrey Henning said. And Jeffrey Henning was, both my predecessor as executive director of MRII and, like you, a former president of MRII, he did a study where he tried to identify, like, what are the key personality traits of a successful researcher. And the big conclusion he came to, it really came down to curiosity,
Yeah.
like a love of learning. If you're the kind of person that when a new client comes along, you're going to throw yourself into learning about that company and that category and how consumers make decisions there. If you love throwing yourself in there to learn about some new category and how people tick, then this might be the right career for you.
Absolutely, and always asking why. I think my mother thought that I was born asking why, so this was probably a good place for me to end up.
That's funny. That's funny. Well, we have just a couple minutes left. I was wondering if you just talk a little bit about your take on our organization, MRII, how you got involved, how you came to be president. You're still involved after many years. Tell me your perception of the organization and how it helps people.
I think it's a terrific organization for learning and for coming from a very specialized industry like pharma, having the opportunity to meet people in other fields and learn from them and understand what other issues are that we don't deal with in the pharma industry, and conversely that they need to deal, they can get to know about medico legal and things like that. My first introduction, when I first went to Squibb, we had an intern from the University of Georgia program, and she was terrific. We wanted to hire her, but she went back to her original geographic area, and we had a second one. And through that, I became involved with MRII. I saw them at a couple of conferences, and I think, like any organization, you volunteer to do work, you get to be head of a committee, and then you get to be president, and that's how it works. But I've continued to be involved because of the value that the organization brings to me, the networking that I do. Anyone in this field, I recommend MRII or the University of Georgia program. In fact, just recently, a board member of mine on the course board has taken over the market research company at a major agency and said, "Where do I go?" And I said, "I have exactly the place for you." The Market Research Principles Express course, for example. So the constant updating and learning that is available on the person's time, from the express courses, the more in-depth curriculum, to get the degree. I think it's a terrific program, and I'm always looking for places to recommend people to check it out. And I've loved dealing with people from all these different industries over the years, and calling on them occasionally for some thorny issues that I've had. So I've appreciated that too.
That's great. Well, we, as an organization, appreciate everything you've done for us and for the industry as a whole, and really appreciate all your time today. Thank you very much, Charlotte.
Thank you very much. My honor and my pleasure. Have a great
Take
day.
care. Bye.
Thanks.